Hi everyone, in today's video let's look at what makes a really great looking smile. Okay, so my name's Gus, I'm a cosmetic dentist based around London in the UK, and 99.9% of what I do is helping patients to get a great looking smile. Okay, some patients who are looking to have all on four or something like that, the aesthetics of the smile isn't the most important thing, but it's always nice to get the aesthetics looking right for that patient. And in this video I'm going to talk about the 5 of the most important principles in smile design. Okay, now if you know anything about smile design, you'll probably know there's about 30 or 40 different things that we can tweak, tiny little elements here and there, but these in my opinion are the 5 most important. So let's start. Number 1 is the smile line. So if you look at a really good smile, what you'll notice is that if you draw a line on the lower lip and you draw a line which is going through the edges of the top teeth, what we want is for these two lines to be parallel. Okay, so you want the bottom edge of the top teeth to create that nice little smiling arc. And if we look at some patients we've helped in the past, I mean this one, you can see that the front teeth are shorter than the side teeth and it creates that opposite arc on there. So this is called a reverse smile line. Okay, so we often want to increase the length of the front teeth or shorten the side teeth to help correct this reverse smile line and turn it into a nice symmetrical smile line. Okay, and this smile line dictates the lengths of the teeth we want in the final result. The next thing we want to look at is our midline, and a lot of people, when they start going down the journey of cosmetic dentistry and improving the look of their smile, they'll start looking at the midline of their top teeth and comparing it with the bottom midline. Okay, this is the wrong thing to do. The top and bottom midlines are very rarely coincident, and it's just not noticeable from a cosmetic point of view if it is or is not coincident with the bottom. What we actually want to do is draw an imaginary line down the middle of the face. And bear in mind, nobody has a symmetrical face. Sometimes the nose is off to one side, sometimes one eye is lower than the other, one eye is bigger than the other, the earlobes are not symmetrical. But these are things that we can look at to get an idea of where horizontal should be. Okay, so we can look at the earlobes, we can look at the corners of the mouth, you can look at the side of the nose, the eyes, all of these things to draw imaginary lines horizontally first, and then we draw a vertical line down the middle of the face. This is called our facial midline, and what we want is our dental midline of the top teeth to be parallel with this facial midline. It doesn't need to sit on top of the facial midline. Okay, so what I mean is our midline doesn't actually need to be in the middle of the face. There's been a whole bunch of studies to show how far this top midline can be, and realistically it can be 3 to 4 millimeters out and hardly anybody will notice. Cosmetic dentists, orthodontists, they may notice this because this is what we're looking at day in, day out. But if we're just looking to create a great looking smile, the position of this midline is very difficult to correct often, especially if you're not looking at brace treatment. Then don't get hung up on the position of it. Make sure it's parallel with the middle of the face. That's the most important thing. A canted midline where it's not parallel is very, very obvious. So it's really important to get the midline in the middle as much as possible, but parallel with the middle of the face. Now, we've looked at the midline, we've looked at the smile line. This is the cornerstone of our great smile. The next thing we're going to look at is the width of each tooth. So what we want is our front two teeth to be a certain width, okay, and there is height width ratios which I'm going to talk about. Let's just say it's 8 millimeters wide. Okay, the front tooth. We then want every single tooth as we go further back to look smaller and smaller. Now in reality, if you look at a back tooth, it's bigger than a front tooth, but you can't see the whole of the back tooth, so we want it to look smaller. Now there's a proportion that we want each tooth to get smaller by, and you can look this up, it's very well documented. It's something called the golden proportion, and this golden proportion is roughly 1.6 to 1. So what I mean by this is we want this front tooth to be a width of 1.6, okay, not actually 1.6, but that's a ratio, and then we want the next tooth to be 1 in comparison to this 1.6. So it roughly gets smaller by a third each time. Okay, so if you look at this smile, you can see that as we look at this smile front on, this tooth is bigger than the tooth in front of it. So this is the opposite of what we want. We want each tooth to get smaller as we go along. So we need to figure out what we can do. Is the front tooth too small? Is the back tooth too big? Is it too far out of the arch, or do we need to bring it in to hide it? So the thing which we need to concentrate on is how are we going to get this golden proportion to make it look like the whole smile is harmonious and pleasing to the eye. So we've looked at our smile line, we've looked at our midline, we've looked at the golden proportion. Now let's look at the tops of the teeth. Now not everybody will show the top of their teeth when they smile, laugh and talk. It's very dependent on how much muscular activity you have up here. Some people's lips move absolutely loads when they talk and smile. Some people hardly show any tooth when they talk and smile. A lot of these things are age related. As we get older, we show less and less top tooth, more and more lower tooth as well. But let's say we are treating somebody who smiles really widely. We want the tops of each tooth to be roughly in a straight line. And not only that, if you look at the arch on each tooth, what we want is the highest point of that arch isn't in the middle of the tooth, it's slightly to the back of the tooth. And then we create that nice little arc at the top of the tooth. Now this is going to bring us on to point number 4, which is our axial inclination. So what I mean by this is if we draw an imaginary line, again, through the highest point of the tooth, which is how we've just discussed on the a little bit towards the back of the tooth, if we draw a line from there to the tip of the tooth, we want each line to gradually just tip in a little bit. The front two are pretty much symmetrical, but then we want all the other ones to tip in by roughly about 5 degrees as we go further back. If we were to draw imaginary lines and extend them all the way down, we want them roughly to intersect at the belly button. Okay, in that kind of area. It's not an exact science, but this is the kind of thing that we're looking for. Okay, so point number 5, you can't really see on a photograph that well. Point number 5 is our proclination of our teeth. Okay, so what I mean by this is how tipped forward they are or how tipped back they are. And a lot of the tooth position for proclined teeth or retroclined teeth is to do with the lower lip. Okay, or the lips in general. You see, the position of the teeth are typically in a balance. You have your tongue pushing forward and you have your lips pulling in, and usually your tongue pushes forward a little bit more than the lips, but because there's kind of like an internal shock absorber in the tooth, it doesn't actually matter as long as they're not a million miles away, these two forces. Now, for smile design, typically we want the facial surface of the tooth, so the bit that you can see, we want that to be roughly parallel to your facial plane. So if someone is naturally just looking forward, we want the teeth at roughly 90 degrees to the floor, to the ground. So if teeth are proclined, it means they're all tipped forward. If they're retroclined, it means they're all tipped back. So again, if we're looking to do an all-on-4 or a full smile design, this is just one of the things we look at, is trying to get that tooth to be in the right plane. It also helps because if a tooth is tipped back, it can look darker, because what happens is all the light hits it and reflects down and creating, you know, a bit of a shadow. Whereas if a tooth is upright, it reflects more light, and as long as the tooth has got nice texture and color, it will look like a nice, bright, healthy smile. Okay, again, another thing is when you rub your tongue over the front of all of the teeth, you want it to be a nice, smooth arch all the way around. And if you get all of the other things right, then typically you do end up with something like that. Now, I could go on about a million other things to do with smile design, but when I'm talking to my patients and we're looking at improving the cosmetic appearance of their smile, what we'll always do is have a smile photograph and work through each one of these points one by one. And my patients always find it really, really useful to go through this process, which is why I made today's video. If you're thinking about improving your smile and you're not quite sure what it is about the smile which is not quite right, just go through this whole checklist, have a photo of your smile and just draw on it where your teeth ideally should be, and it will give you an idea of what you need to improve to get that perfect smile. Okay, so I hope you found today's video useful. As always, please leave comments below. If you liked it, give it a thumbs up. It helps other people find the video. And until next time, take care. Have a great week. Take care.